Good evening, I'm Marivel Charouk. The number of opioid overdose-related deaths in the city has hit an all-time high. There were 27 suspected deaths in July, a record since Toronto Public Health began keeping track. The TPH also says there has been a staggering increase of suspected overdoses during the pandemic. As TDIN reports, one expert says it's not a surprise.
The numbers are grim. Toronto paramedics attended 27 suspected opioid overdose deaths in July, a monthly record, but also only slightly more than April and May, with 25 deaths occurring each month, most of them downtown. Those numbers are an 85% increase compared to the monthly average last year.
It's incredibly tragic, but at the same time, I hate to say that I don't find it particularly surprising.
Diana McNally from the Toronto Drop-In Network says the pandemic is taking an indirect toll.
It's not really about COVID, it's actually overdose, which is really killing people who are street involved. The pandemic has been incredibly stressful on a lot of people, and so, using drugs can be a coping mechanism, especially for street involved people.
She says many have also lost access to much-needed services, such as supervised injection sites.
A lot of people, where they're being moved into the hotels aren't anywhere close to those services. So people are using in spaces that they're not really familiar with.
The Ontario government said it provided emergency funding of up to $12 million in April to expand online and virtual services for mental health and addictions.
Having access to Wi-Fi, having access to a phone isn't something that people readily have. So a lot of those services aren't really applicable to the people that we work with. And, that's well over 10,000 people on the street at this point.
The province also said it continues to fund and support all 21 consumption and treatment services sites in Ontario. But McNally says that is not enough.
They defunded 2 sites in 2019. Those 2 sites are still defunded and operating without any provincial funding at all. They're privately funded. So what I'd like to see is those 2 sites to have their funding restored and to realize that the number of people who are dying on a monthly basis, this is outstripping COVID at this point. This is actually a crisis.
Toronto Public Health is also warning of an increasingly toxic drug supply and is reminding drug users to carry naloxone. TDIN, CBC News, Toronto.